well-groomed, clean, no apparent signs of distress, and the patient is dressed appropriately for the situation. Under behavior, you would say that patient's attitude, mood, and affect are appropriate for the situation. The facial expressions are appropriate. Cognition, the patient is alert, that's mental status, and oriented ×4, or you can say oriented to person, place, time, and purpose, and the speech is clear. All right, that was it for objective data under general survey. Next, under cognition, sensory perception, mobility, we already said the patient was alert and oriented ×4, so that was already covered. Sensation to touch to upper and lower extremities are intact bilaterally. The patient moves all extremities, and strength in the upper and lower extremities are 5 out of 5 bilaterally. Or you can say strong bilaterally. Don't say both. All right, so 5 out of 5 or strong bilaterally. Now, hand grips are only for neurological patients. And since we're just doing a head to toe, you guys are not needing to do hand grips and foot pushes, right? But if you wanted to, and if you included it in your assessment anyway, I won't dock you points, but your assessment would be hand grips and foot pushes, strong bilaterally. You cannot say hand grips 5 out of 5, because when you give your fingers to your patient and your patient squeezing, you're not giving resistance. 5 out of 5 is when the practitioner gives resistance. That's how you're able to grade it. Does that make sense? So if you're gonna describe hand grips, it's always just gonna be strong bilaterally, or right greater than left, left greater than right, okay? Tissue integrity. Objective data, the color is pink, or you can say appropriate for race. If your patient is not pale or light skinned, then you would say appropriate for race. Temperature and moisture. Skin is warm and dry. Hydration, the patient's, what is it? Skin turgor has immediate recoil. Okay. Open up the mouth, use a pen light. Oral mucous membranes are pink and moist without any lesions. Oxygenation objective data. The patient's respirations are regular rhythm and even and unlabored. So deft is even and effort is unlabored, right? So respirations regular, even, and unlabored. Posterior chest lung sounds are clear to auscultation bilaterally, or you can just say clear bilaterally, okay? Perfusion. You're listening at the auscultatory sites, A, P, T, M. If you wanted to include Erb's point, that's fine. There's nothing wrong with that. You're gonna listen and you're going to say, and then you're gonna turn it over to your bell, backtrack, and then you're gonna say S1, S2, regular, not normal, not good, right? S1, S2, regular or irregular is the abnormal finding. No extra heart sounds, no murmurs. Peripheral perfusion. Radial and pedal pulses 2+ bilaterally or strong bilaterally. Either one of those are acceptable. Cap refill 2 seconds bilaterally. Hands and fingers and toes, or just fingers. And then when you get to the toes, you can do the same thing. And then as far as edema, all you're gonna say is no edema. Noted. All right. You should never say no pitting edema, right? Because if there's edema, you can say non-pitting or pitting. But if you can't say no pitting edema, right? Because if there's no edema, there's no pitting. So if there is pitting present, then you're going to decide if it's a pitting edema or non-pitting edema. So all I want to hear for normal findings is no edema, okay? Elimination. On inspection, you're gonna say abdomen is flat or round, no lesions, non-distended. A lot of people say non-distended after palpating. That's incorrect. Distension is assessed by inspection, okay? So on inspection, abdomen flat, no lesions, non-distended. You're gonna listen for your abdomen. Generally, you're gonna say to me, normally I would listen for 1 minute per quadrant, but for testing purposes, I'm gonna listen for at least 5 with pauses and then move on. You're gonna listen for at least 5 with pauses and move on. You're gonna say bowel sounds are active in all 4 quadrants, not normal, not present. And when you say active, you know it's present, but active is the correct terminology for that. On light palpation, you're gonna bend the knees to relax the abdominal wall. You're gonna start with the right lower quadrant first in a circular motion, and you're gonna say abdomen is soft, non-tender, with no masses. You're gonna ask your subjective data about elimination, urinary, and bowel, right? But also here, you're gonna talk about the characteristics of the urine. So normally here, you'll ask your patient, did you use a restroom? Is there any issues? No, and then you will observe the urine, and you're going to describe the color, amount, consistency, and odor. So you're going to say, urine is yellow, clear, with no sediments, and whatever, the amount is 500 ml, okay? And that's it. Performance, you should have done your HiPi. You should start with environmental assessment, and if there's anything wrong, you would fix it. I'm looking for a head to toe manner. I am looking to see that you're checking in with your patient, that you're telling them, I'm gonna move on now to your abdomen, and I'm gonna expose your abdomen. Can you pull your gown up? And I'm gonna make sure I cover you and you're modest, okay? And then of course, clear explanations, and giving your patient any teaching if necessary. Okay, so those are the performance portion, but that's it.